My name is Gail Newel, and I stand for dignity, equity, and compassion. It's such an honor to be here tonight with all of you receiving the Penn Benenson Courage Award. To be able to share this award with my colleague and friend, Mimi Hall, makes it all the more meaningful. Thank you, Mimi. Thank you, too, to my wife, Kelly, world's best doctor, and my daughter, Madeline, who is here with me tonight, both of whom were by my side during protests at our home and threats to our lives. I have been a physician for 35 years. My father was a pediatrician, my mother a poet. She's so proud of me to be here tonight. Both active in our community, both modeling the importance of service to others as the embodiment of love. Throughout my medical practice, I learned from my patients how to be a better doctor and how to be a better person. I learned that the best healthcare is informed by science, yet driven by compassion, that it is equitable, that it must serve those who are the most disenfranchised and the least powerful. From an early age, I felt a fierce commitment to social justice and human rights. Perhaps this is rooted in my Mennonite upbringing, but it has certainly been heightened by my experiences as a woman in medicine, as a champion for reproductive rights, as someone who identifies as queer, and now as a public health officer. If there is one thing this pandemic has shown us, it's that social justice, with an emphasis on anti-racism, must be at the root of our efforts moving forward. I will leave it to others to study the political forces that have brought us to a place where facts and sound public policy are met with anger and denial. What I can tell you is that in the face of that anger, under the threats and vitriol of some of the members of our community, Mimi and I shared a set of values based on honesty, trust, and a recognition of systemic inequality. We both see this award as being for all of the public health workforce, so many of whom operate with this same set of values. Thank you, PEN America, for recognizing our courage and for amplifying the voice of public health during this unprecedented pandemic. Thank you for all you do to protect and celebrate free expression in the United States and worldwide. I'd like to close with a quote from one of my own favorite books, Olive Again, by the incomparable Elizabeth Strout. In a moment of rare introspection, the stoic Olive Kittredge muses about the meaning of life. Her best guess about what the human task may ultimately be in our catastrophic riddle of a world is to bear the burden of the mystery with as much grace as we can. Thank you for making that burden immeasurably easier to bear with your recognition tonight. I am forever grateful.
Thank you, Gail. It is such a privilege to be receiving this award with you, as you have been a source of strength and inspiration for me, and also so many of our colleagues. I echo Gail's deep appreciation for the attention this award brings in support of the public health workforce. I also owe thanks to my life partner, Tom, the love of my life, and our 3 children, one of whom is here with me tonight, Malia. But most of all, I need to thank my parents. It is their courage and their love for humanity that made my life of service possible. They were parents of 3 young children living in Myanmar, and they had lived through British rule, military dictatorship, decades of civil war that included human rights abuses and violence against ethnic minorities. They were determined that we were going to have a different life, a future of freedom for me and my brothers. As immigrants, they held tight to the belief that our uniquely American privileges were also an obligation for all of us to be of service. The values of equity, humanity, and courage were doctrines that they instilled in me through their sacrifices, and these have been the guideposts leading me through many years as a public servant. These are also the values that PEN America has staunchly upheld, previously giving awards to Burmese journalists who bravely reported on violent acts against humanity during the rule of the country's military junta. My parents' beliefs in civil and human rights has made my life's work in public health possible. The challenges of public health work over the last 2 years of the pandemic haven't been that much different than the last 20 or 30. Protecting the community, especially those most vulnerable in times of crisis, is always demanding. But only recently has it become disruptive and dangerous for health officials as well as our families. Like Gail, I feel we're here tonight on behalf of every public servant forced to be in this position, certainly just to pursue our duty, which is to protect our communities. The early steps many of us had to take to protect communities were gut-wrenching. We had phone calls from people saying, "I've lost my job, I can't pay my rent, I've lost my mother and my father." And it touches us as human beings, and the responsibility of life was not lost on us. The collective sacrifices of all of the individuals in all of our communities will be felt for years. The public health measures that we took were informed by science and medicine, but they also brought unprecedented hostility, fueled by disinformation and political divisiveness, amplified by social media, and they were extraordinary in their reach and their nature, and they have definitely posed a risk and a danger to our ongoing pandemic response in this nation. Following our duty to save lives has been dangerous and deeply traumatizing for us. We have been under assault, and so have our colleagues, by the very people whose lives we're working to save. But what I've witnessed in Gail and my fellow health officials and public servants is that when disaster presents itself, our commitment to humanity only becomes more clear. The rapid decline in civility during the pandemic, fueled by volatile political discourse, has been accelerated. The current environment attacking science, evidence, and public health officials who are acting in good faith continues to threaten the safety and the health of our nation. Without protection and support, the already scarce supply of qualified public health officials willing to serve in our roles will only decline. The mass exodus of public health officials, whether it's by force, exhaustion, or fear, has many of us calling this period of time the end of an era. The environment that exists today threatens lives, but it also threatens the very foundation of American democracy. Santa Cruz County Board of Supervisors elected official Zach Friend said to me after a particularly ugly board meeting filled with hateful comments directed at me and Gail, a Latin phrase, "Quisa custodieta ipsos custodissa," or "Who will guard the guards themselves?" Thank you, PEN America, from the bottom of our hearts, for being our guardians.